Welcome to page 46 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The neck muscles, the anterior and lateral neck muscles. The neck is divided up into two regions, the anterior triangle and the posterior triangle of the neck. The most obvious and largest muscle of the anterior lateral neck is the Sternocleidomastoid muscle, right here. And it is the muscle that divides the anterior triangle from the posterior triangle. You can definitely palpate this muscle. It is the most obvious muscle on the neck. And it has an interesting job. It flexes the neck. It brings the head forward, but also tilts the head back at the same time. So, and rotates the neck as well. So, you can see here that when one of the sternocleidomastoids contracts, that it extends the head backward, but also rotates it to the side, to this side. So it extends and rotates the head. When they act together, it flexes the head forward. And here is your sternocleidomastoid originating from the mastoid process. The mastoid process of the neck, of the temporal bone, of the skull, and inserting down at the manubrium of the sternum down here and the clavicle. You can see it has an attachment down here, and it also attaches on the clavicle as well. In the anterior triangle of the neck, that area in front of the sternocleidomastoid, there's a little bone. It's floating in the middle of your neck. It's called the hyoid bone. The hyoid bone, and you can see all these muscles that attach to it. Starting with the Stylohyoid muscle. The Stylohyoid muscle predictably goes from the styloid process of the temporal bone of the skull. Actually, this one right here. The Stylohyoid from the styloid process of the skull and attaching to the hyoid bone. And what that does is something really interesting. There is a sling, a ligament on the hyoid bone that's a little U-shaped, like a horseshoe shape, that the digastric muscle travels underneath. And so it forms like a sling that goes down and through that little ligament and elevates the hyoid. As a matter of fact, that's what all the suprahyoid muscles do. They elevate the hyoid bone. And what that does is it raises the bottom of the floor of the mouth, underneath the tongue. It raises it up. Now, the other suprahyoid muscles are the Myelomyoid, also involved in elevating the hyoid upward toward the mandible. The Mylohyoid in originating from the mandible and also inserting on the hyoid bone. Will elevate the hyoid and the floor of the mouth. The hypoglossus muscle in here, and in here, and here, involved with the others in elevating the hyoid and the floor of the mouth. And down here, the Geniohyoid muscle, also from the mandible, elevating the hyoid bone. All of these originate, except for the Stylohyoid, they all originate at the mandible and the posterior belly of the digastric. The digastric muscle has two bellies, the anterior belly and the posterior belly. The posterior belly originates from the temporal bone, and the anterior belly originates from the mandible, the digastric fossa of the mandible. And of course, the hyoid bone, suspended among all these ligaments and muscles here. Now on to the infrahyoid bones, or muscles. I'll start over with the colors here. The Sternohyoid, aptly named because this muscle originates from the sternum, down here, and upward to the hyoid bone. And of course, what does it do? Well, supra means above, and infra means below. So these are the muscles that are below and are going to pull the hyoid down. The Omohyoid muscle takes a crazy path here from the scapula all the way up to the hyoid bone, the scapula of the shoulder. The Omohyoid muscle. The Thyrohyoid muscle originates from the thyroid cartilage of the larynx, which is your voice box. And it can be seen just a little bit right here, and just a bit down here. Tiny muscle. The thyrohyoid. The sternothyroid is a muscle that, aptly named, travels from the sternum to the thyroid cartilage of the larynx, which is your voice box. And just a little bit of it can be seen deep underneath here and underneath the sternocleidomastoid. And here's the thyroid cartilage of the larynx, the voice box. And here's your sternothyroid, originating, as I said, from the sternum upward towards the thyroid cartilage, inserting on the thyroid. It's the sternothyroid muscle. And as stated before, the sternocleidomastoid muscle is the muscle that delineates between the anterior triangle and the posterior triangle of the neck. And so now we've discussed already the anterior triangle, and now it's time to discuss the posterior triangle of the neck. The posterior border of the triangle is bordered by the trapezius muscle, a large muscle extending from the occiput, or from the clavicle and scapula, and the vertebrae up to the skull and to the vertebrae of the cervical and thoracic spine. Of course, you have your sternocleidomastoid here. And so this represents the posterior triangle here, all these muscles found in between. And so starting with the Semi-Spinalis Capitus muscle, you can barely see it just a little bit right in here. It's covered up by the trapezius muscle. And it's more of a posterior muscle. It's considered in the posterior triangle because there's just a peak of it, but when you remove the trapezius, it's much more visible. Semi-Spinalis Capitus, and it runs down, straight down, essentially the back of the neck, and attaching to some thoracic vertebrae from thoracic vertebra all the way up to the skull, the base of the skull, the occiput. The Splenius Capitis is a more angled muscle. Here, the Splenius Capitis, called Splenius because it's in the direction and shape of a bandage, sort of. Splenius Capitis. Capitis means head, so it's going to attach to the skull, just like the Semi-Spinalis Capitis. And it too runs down the back of the neck and into the thoracic vertebrae, originating in the thoracic vertebrae. And as you can see, inserting on the occiput or the base of the skull. The Levator scapula muscle is all aptly named because it elevates or lifts the scapula. And you can see the angle of the scapula right here, and the levator scapula running from the angle of the scapula upward, and it actually attaches to the atlas, C1 vertebra, as well as C2, C3, and I believe C4 as well. So it's attaching to the bones, the vertebra of the neck, and elevating. You can see, obviously, would pull this scapula upward in that direction with its insertion on the angle of the scapula right down here. The scalene muscles, the scalenus anterior, middle, and posterior, originate from the second and first ribs. And what they do, and that's the scalenus anterior, he's the scalenus medius here. And they will bend your neck, as you can see, with their angle there, and they attach, and we'll do the scalenus posterior here. They go from the ribs, originate the ribs, and they attach the sides of the transverse process of the cervical vertebrae. They will bend your head over to the neck, to the left and to the right, and if they act together, they will help to flex your head forward. Incidentally, the Sternocleidomastoid, I mentioned it extends the head back. I mentioned that it act bilaterally. They can flex the head forward, but it also bends the head to the side and rotates it. But the scalenus anterior, medius, and posterior will flex the neck and flex it forward, and also bend it to the side. So that's the anterior, medial, and posterior scaling. Let's follow the path of some of these other muscles with these, the diagram from the anterior. The Thylohyoid muscle, we get a better look at right here from the styloid process down, attaching to the hyoid bone. And you can see the really neat path of the digastric muscle actually passing through a split in the Thylohyoid muscle. And you can see how these muscles will elevate the hyoid bone from their from the way they're situated there, and bring it upward, bring the roof of the mouth upward. By the same token, you can see how these infrahyoid muscles, which are situated inferiorly or below the hyoid, you can see how, for example, the Sternohyoid, or how the Thyrohyoid and the Sternohyoid, originating at the sternum, inserting on the hyoid, will pull downward and depress and sort of create a base for the stabilizing the hyoid muscle, or the hyoid bone. And the omohyoid, this is a great look at the path here. Like the digastric muscle, the omohyoid travels through a sling and then travels all the way down to the scapula. So interesting that the roof of your mouth, the bottom of your mouth, the floor of your mouth is attached to your scapular muscle, or your scapular bone. And here is the sternothyroid bone from behind the sternohyoid. And this represents page 46 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Until next time.